Hi, everyone, and thank you so much, Yara, for the introduction. And I just want to say that it's such an honor to be here with you ladies this evening, afternoon, or wherever, whatever time it is that you're joining from. And I'm beyond excited to be sharing this time with you all. And now, without further ado, I'd like to invite you all to move into the discussion. We have a couple of questions prepared for you. And the first one is, what motivated you to become an Srhrj advocate? I would like to ask you to take turns to answer. Sophie, would you please go first?
Yes, I would love to. Hi, everyone. Thanks for having me. I'm really excited to be here. I guess for me, the answer is quite easy. I grew up in Georgia, which is a predominantly very patriarchal community. Growing up as a woman, growing up as a queer woman, it has always been difficult systemically, education-wise. There have always been barriers. So, that sort of led me to my activism and my work.
Wonderful. Thank you so much, Sophie. Lolo, would you like to go next?
Yeah, sure. Thank you for having me. I'm really excited to be part of this panel discussion. I think just like Sophie, my activism also started from a personal struggle. I'm Nigerian, so I grew up in a predominantly Igbo neighborhood, Igbo community where issues around sex, sexual and reproductive health were really shrouded with a lot of secrecy. And if you add the fact that I also lived in a patriarchal society, due to the lack of knowledge and due to the stigma and the shame surrounded by SRS and around our sexual and reproductive health, it gave room for a lot of abuse, a lot of violence. And the awareness of that vicious cycle or that unhealthy cycle led me to start my journey into Srhrj education and activism, because if I can close that loop by providing knowledge and also, on the other hand, fighting for women's rights and reproductive health, I can really tackle it from both sides. So that's really my journey.
Thank you so much for sharing this, Lolo. Nelly, would you like to answer next?
Yeah. Yeah, thank you so much, and really excited to be, participating and contributing to this very amazing conversation where we see young girls taking the mic and speaking up. Just like Lulu and my other colleague, I grew up in the western part of Kenya, where women were not supposed to be heard. Women were married off early, and their dowry was used to pay off the boys' school fees. So basically, boys were given more opportunities than girls. I grew up in a society where, women were supposed to be in the kitchen, their role was basically in the kitchen. Thanks to my parents that provided very good education to me, and I ended up in nursing school. Nursing school provided me with an opportunity to be able to speak up and fight for the rights of women and girls. And I found an opportunity with the organization that I currently work with, to be able to, be the voice for the girls and women in our country, and be able to even hold the, government accountable. Our society is basically patriarchal, and we have struggled over the years, even for the, gender equality, just to make sure that women take up some of the very progressive positions in the country. Having the women, even just speaking up has been a problem. So those are some of the things that really pushed me into the woman I am today, into the nurse that I am today, to speak up for the women and girls back in our country in Kenya. Thank you.
Thank you so much, ladies. This is very impressive, the job that you're doing. And thank you so much for sharing your stories. On to the next question. Could you please share what does body autonomy means to you, and how do you think it's connected to sexual and reproductive health, rights, and justice? Sophie, would you like to go first again?
Yeah, sure. I guess bodily autonomy for me is the complete opposite of what the US Supreme Court did quite recently. It means being able to make informed choices about our own bodies, but even more so having the necessary resources available to do so. So one of our colleagues recently was talking about period poverty, for example, and accessibility to pads, tampons, different period products. If in toilets we're not provided necessary sanitary products, for example, we're not able to exercise our bodily autonomy. So that defeats the whole purpose. It's all connected in my head. The whole justice and rights aspects of it is very much connected to accessibility and seeing those options, that we have. Because if we don't know that we have the option, we won't be able to make those informed choices.
Agreed. Thank you so much, Sophie. Nelly, would you like to go next?
Yes, thank you so much. So bodily autonomy basically to me means one's control, having power and ownership over your own body. And this is something that we do not see. It's something that has continuously been, has been infiltrated. And this means that one is taking charge and being able to make decisions about their bodies, being able to make decisions in terms of who do I want to have sex with, who do I want to get married to, when do I want to have, babies, for example. It's the power to be able to make choices over your body. And, the connection between this and what we do under the Sexual and Reproductive Health and Justice is to be able to make that access for safe abortion services and contraceptives. They should be able to have sex, and beyond sex, they should be able to have sex pleasure, because this is something that, women and girls and even men don't get to enjoy it because no one talks about it. No one allows them to do this. And, most of the time they are abused because of values that are being, forced to us. And just to say, some of the policies that are put in place, you want to dictate for a woman, when and how to, live their lives, what to do with their bodies. So bodily autonomy basically give freedom. Let women do what they want to do. Let the girls decide about their bodies. Thanks.
Thank you, Nelly. On to Lulu. Would you please share?
Of course, I would. I think I just have to reiterate what my allies have said, Sophie and Nelly. It's really the ability to make informed decisions about your body. And the other layer I would say is the ability to make informed decisions about your body without facing punishment. And if you look in our society right now with the kind of policies, practices, behaviors, and attitudes we have around Srhrj, you can see that if I make a decision about my body, there is this thing at the back of my mind that I'm going to be faced with punishment. We see what's happening in the US that if you have sex, if you enjoy sex, if you have pleasure, you're going to be faced with a punishment. And that punishment is for you to carry the pregnancy, even if you do not want that. And that really goes against bodily autonomy. We also have practices around FGM that are still happening in our communities till tomorrow. And even if it has been modified in different ways, these are violations that are still happening on women and girls' bodies. And there are also certain laws or certain policies that make it difficult for rapists or perpetrators to be punished, because if you have a policy that says a perpetrator can go scot-free if he marries the victim that he has raped, you are depriving the right of the survivor to bodily autonomy. So for me, the connection is evident. There is no way I can talk about sexual reproductive health without talking about sexual reproductive health rights and justice. So this is how I see it as a holistic discussion.
Wonderful, very empowering. Thank you. Because the issue of sexual and reproductive health rights and justice exists indeed in many countries, I believe that a lot of us would really benefit if you would share more about your day-to-day work that you do and how you tailor your messaging and approach to the community you work with, so that we as an audience could basically have heard maybe like pieces of advice or tips from you on how you approach your messaging and tailoring it to your team. Lolo, would you like to go first for that question, please?
Yeah, sure, no problem. So the way I work is actually in 2 layers. We do the grassroots advocacy and we do the digital. I do the digital advocacy. For the grassroots advocacy, I do a lot of sexuality education, a lot of focus group discussions with my community members. I do this with sex workers and brutals as well, talking to them about their rights as women. Even if they're sex workers, they do have rights. We do this every month. I do comprehensive sexuality educations at the juvenile prisons with the boys, because we realize that a lot of these boys in these juvenile centers are there because they actually violated someone's body or their rights. So to make sure that we are closing that knowledge gap, that they don't go back into the community and continue to perpetuate the behavior that put them there in the first place, we take our sexuality education to these places. And also, I've been working with a lot of teenagers, a lot of secondary schools, and also primary schools. So that's really the grassroots advocacy. For the digital advocacy, I do a lot of content creation to foster conversations around sexuality, around reproductive health, to encourage discourse. Because again, I say a lot of violence hides when it's shrouded by, when issues around sexual and reproductive health is shrouded with a lot of secrecy. So the message and the approach I use a lot of case studies that are tailored to the realities of the people I'm working with. If I'm having a sexuality education training, I'm going to use an example that is so close to home that they're able to see themselves in it. I also use terms that they are familiar with. I do not use jargon. Even if I'm in this space, it's very easy for me to think that everybody in the space understands. But if I'm trying to break down a difficult concept into understandable ideas, I have to use simple languages. And also, I partner with community leaders wherever I work. So I just don't go there to work for them. I go there to work with them. That way they see it as a community development, and I'm not just going there to impose my ideas of what I think they should do, but foster conversations with them for them to actually reach the destination that I want them to reach. And in the process of getting to that point of awareness, of autonomy, is empowerment on its own. So this is really how I structure my advocacy.
Thank you, Lolo. I would like to ask Nelly to answer the question, please.
Yeah. So thank you so much. I work with a network of healthcare providers in Kenya, and these are providers that support access to sexual and reproductive health rights and services. So what we do as on my day-to-day, what we do is make sure that, one, we are building the capacity of healthcare providers to be able to, one, provide services to women and girls in the vulnerable communities. And this is comprehensive sexual and reproductive health, which includes access to safe abortion services, contraceptives, including the other components, HIV screening, cancer screening, etc. We also train the healthcare providers as advocates. Healthcare providers are experts when it comes to policy development in our country, and therefore our healthcare providers are able to engage policymakers at the national level to ensure that they are looking at what policies exist, what gaps are there, and how do they progressively support the ministry to put together progressive policies. Our healthcare providers also support in advocacy through media engagement, where they go to mainstream media for interviews and provide evidence, facts when it comes to sexual and reproductive health. They also engage in community dialogues as experts with the community leaders to make sure that they are also providing the right information when it comes to sexual and reproductive health and rights. We also work with the network of young people, and for the young people, we appreciate the role young people play. In terms of programming, we have young people that support the organization and support us to think through, how do we meaningfully engage the young people? How do we make sure that they are also providing the right information when it comes to Srhrj to their peers, both in and out of school and at the community? We also use them at the grassroots to engage with policymakers, where they are able to hold them accountable and be able to also express what are the needs that the adolescent and youth, for example, need. They also are, very strong advocates, and we engage them in the local radio stations, TV, where they go there to also provide information on Srhr in our country. Beyond that, we also work with policymakers just to make sure that they understand what is the legal framework of Srhr in our country. And progressively, we make sure that they are making progressive policies to make sure that no one is left behind when it comes to Srhr. We make sure that it's an all-inclusive process where we have all the key actors, from religious leaders, opinion leaders, community leaders, teachers, parents, healthcare providers, being together to make sure that access to Srhr is given priority, given that it is a fundamental right. Just to mention that in Kenya, in our constitution, there's provision to access to abortion, for example, and health is considered as a basic human right. So, and sexual and reproductive health is not left out. So we push for that to make sure that progressive policies are put in place. We have cross-generational spokespeople and putting the adolescent and youth at forefront when it comes to Srhr. So basically, that's how my day-to-day work looks like. Thank you.
Thank you, Nelly. Sophie, would you please share?
Yes, of course. I think my colleagues covered the most fundamental cornerstones of how we, as the third sector sort of workers, approach our Srhr activism. I just want to really highlight the fact that in our work, it's really important to balance those different hats that we have. Because for us at RFSL Malmo, for example, which is the more local branch of the national RFSL organization, we work specifically with queer refugees, which is a minority within a minority. So in that sense, when we approach our beneficiaries, we don't make things political, because being political is also a privilege in a lot of contexts, and we need to be aware of that. We need to be aware of the different privileges and power dynamics in different rooms and accommodate to that. And they need us as humans, as allies, to support their needs, which are very personal and not always political, but with their consent, of course, we take these messages and then bring them to advocacy spaces, locally, nationally, regionally. So I really like to highlight that as well, that being political is important, but it's also a privilege that we need to be aware of, basically, in our work.
Thank you so much, Sophie. We now have a question from the audience, from Gabriella. And Gabriella asks, what was the biggest challenge you faced during your activism? What is a story about a hard situation you've faced? This question is open, so whoever wants to answer this question first, please feel free to go ahead.
Yeah, sure, I can go, just because I've had longer time to think about the question. For me, I would say one of the challenges or one of the difficulties that I faced here is the bullying. We are talking about issues that people just do not want to talk about, or rather would pretend they do not want to talk about. So being very bold and open about these issues, and also ruffling feathers, because I want to say something, I want you to react, I want to trigger you into action. I've been faced with a lot of bullying online and offline just because I'm advocating for this, and two scenarios actually, but I would say one was, I think this was 2 years ago, and I was talking about abortion, but I was specific about the medical abortion, so the pills, over-the-counter pills, and I, using my platform to talk about these pills, telling people that they exist, using the names, and for 3 days, I was bullied, people calling my employers to get me fired. It was really, really bad, and the organization I was working with had to keep calling me every second to ask if I needed security. I didn't even see these replies because I'd muted it, but the fact that it was so vicious, the fact that everyone was in uproar, from even feminists, activists, medical doctors, just because I am ruffling feathers and saying that thing that should not be said. So for me, I would say is the challenges of bullying and having to get past it and recognize that even if you're bullying me or you're upset at what I said, I don't have to react to you. I actually have to calm down and respond and say, you're reacting based on a template. Maybe it's out of fear, maybe it's out of shame, maybe out of a certain stigma. I have to be empathetic, even if I hate to say this, it comes at my own expense. I have to be empathetic because I'm trying to move the conversation forward. I have to be the bigger person in that situation. But yeah, it does take a toll on the mental health. But yeah.
I could add to that, definitely. I think that's a very common experience that us activists experience. Burnout is real. It's never fun, and we have to make sure that we're taking the best care of our own health and safety first. What kind of irks me is when people sort of glorify activism. I don't think anyone ever grows up willing to be an activist, because being an activist means that there is something wrong with society systemically. And this is sort of us citizens trying to seek out justice in one way or another through education, which in my opinion is the most radical act of activism and we can, accomplish. So yeah, I definitely agree with the bullying and the mental health and all of that. Yep.
Mm-hmm. Probably just if I can also go. We have seen a lot of regression, and we've also seen a lot of opposition, a growth in opposition attacking the Srhrj agenda, I think globally, regionally, and nationally. And for instance, for us in Kenya, myself, that advocate for access to abortion services and for the LGBTQI folks, we have been branded, if you translate it from Kenya, basically it is a white agenda. And then we have also been branded murderers, killers for, fighting for the rights to access to safe abortion services. And just like Lulu, we've also, I've faced bullying on social media where you wake up, there's a Twitter chat, and your name and your photo all over, being branded as a murderer. So really, I think we need to come out as a global movement to be able to also speak up just the same way the opposition are doing. Thanks.
Thank you so much for all your incredible answers. This session was really inspiring, I hope. And I'm pretty sure that it was very, very empowering to all of us who listened. And I'd like to thank you for your time.